the webinar in about 1 minute. We're just going to wait for a few more people to show up, but I want to welcome you, and we'll get started in 1 minute. All right, so why don't we go ahead and get started. Again, good morning and welcome to the webinar. My name is Dina Rodriguez and I'm the project manager for the Community Health Training Institute, and we're happy to be bringing you this webinar addressing challenges and barriers to implementing a CHIP. In a moment, we will have our presenters introduce themselves, Rose and Amanda, but before we did that, I just wanted to give you a little bit of information about this webinar. You should have received an email from Kelly, our coordinator, that we wanted to make this webinar a little bit more of a conversation. It can be difficult in a webinar because you are listening to us, but we want you to make handy of the chat box that's on your screen. It looks like this. And we want you to plug in any comments and questions in this box as the webinar is moving forward. Anything that comes up that you think, oh, I really want to ask this question, or I'm really struggling with this challenge, please, please, please engage with us because it's going to make the webinar more fruitful. We also want to let you know that you can follow us on social media, HRiA Institute on Twitter. We will be live tweeting throughout the webinar, and we want you to use our hashtag MACoalitions, and we want to let you know that this webinar is brought to you for free thanks to the generous funding by the Department of Public Health. And again, if you have any questions or audio issues, plug that into the chat box as well, and we'll be monitoring the chat box throughout the day, and I'll call it a chat box, question box, but you'll see that option at the bottom of that little bar that looks like this. So I'm going to hand it over to Rose, who's going to take us through our agenda with Amanda's help as well.
Terrific. Good morning, everyone, and thank you for joining us. And thank you for participating in somewhat of an unusual format for a webinar. We are hoping that this will be an interactive dialogue where you feel free to raise particular issues or challenges that are confronting you as you're beginning a CHIP process or you're moving from your plan to implementation. And the structure of the session is going to go a little bit like this. We're going to present a series of very common challenges. And these are presented as such, and we'll describe them. And then we will, following each challenge, give some strategies for dealing with those challenges, what we call strategic opportunities. So each challenge is followed by strategic opportunities, in some cases multiple strategic opportunities or ways to think about addressing those challenges. We'll go through 4 or 5 of those, and Amanda and I will be tag teaming on that. And then we'd like to really open it up and answer any of your questions or dig more deeply into some of these topics as you would like before we close the webinar for the day. So that's kind of the overall structure. We'll present a little bit up front, and then we're really going to turn it over to you to help guide the rest of the session. Advance, please. Can we go to the next slide?
Yes, 1 second. For some reason, oh, there we go. Sorry, there was a little bit of a lag there.
That's okay. So for those of you who have not met us, we thought it would be helpful to see pictures of the people who will be speaking with you today. I am Rose Swenson. I'm the Managing Director of Strategic Planning and Organizational Effectiveness at Health Resources in Action. I have been very pleased and honored to have been involved in a number of chip planning efforts nationally, and so have a wealth of experiences from community partners and clients that we can share as sort of best practices for going forward. And Amanda, if you could introduce yourself, please.
Yes, thank you, Rose. So my name is Amanda Ayers. I am a senior project manager, also with the Strategic Planning and Organizational Effectiveness Group at HRiA. I've been in the field for 20 years and have been lucky enough also to participate in many local and statewide health improvement planning programs, practices, and the development of plans. So we're really excited about being able to talk to you all today, and I hope you all will use this as an opportunity to learn from each other, as well as hopefully get some helpful information from us as well. So thank you.
Thank you, Amanda. Could you advance, please? Okay, so we are going to talk through, again, some of the common challenges that we have seen with CHIP implementation. And again, we've been fortunate enough to work with a number of coalitions from the beginning, the sort of first wave of developing a CHIP, and then the second wave of saying, okay, we have a really nice looking plan. Now what? So we've gone all the way from the beginning of the process to the conclusion of a 3-year CHIP, or in the case of the state of Connecticut, we're in the second year of implementing the statewide health improvement plan. So we can readily share some of the challenges, but also some of the innovative things that people are doing to address those challenges. And again, we're hoping to provide some of that TA to you, and hopefully, as Amanda said, I think, which is a really key point, is have you share your own stories with each other. Advance, please. So I'm going to begin the presentation by talking about a very common challenge. And by the way, when we list these challenges, they're in no particular order of importance. But in this case, it seems that the conversation very often swings back to the reality of how do we support this work, both in terms of financial capital and in terms of human capital. So when you have a lack of resources to sustain the work, you have the breakdown of the multi-sector, collaborative, partner-oriented piece that really is the intent behind a CHIP coalition. And so what happens is the initiatives dissolve, the coalition kind of becomes fragmented, and you're back to sort of square one, where services are being provided, initiatives are being championed, but they're not necessarily done in a coordinated, focused fashion. And because of that, we're not getting the leverage that we would like in terms of institutional knowledge, institutional resources, but also the impact overall on population health. So let's advance, please. So what do we do about that? And the strategic opportunity is really working as a coalition to develop and secure diverse resources to support and sustain the priorities of the CHIP. And again, the CHIP is designed to be the umbrella linking document that focuses efforts around activities and strategies that all of the coalition partners agree to work on together. So balancing that collaborative partnership with the need to be self-sufficient is an important consideration as you begin action planning for the CHIP, and as you begin to think about what are our available assets, where can we secure additional assets if needed, And as you kind of move through year 1 action plan to year 2 action plan, if a source of funding is no longer likely to be in place, what are the strategies for replacing those funds? So there are a number of different types of strategies that we have seen employed by coalitions to ensure financial stability. The idea of a community partnership is to pool resources to really kind of support and sustain this work, and to put those resources behind areas for collective impact. In Travis County, Texas, they actually developed what was called an interlocal agreement. And this was between Health and Human Services and Voc Rehab Services. And they agreed to supply or provide $35,000 a year for 3 years to support the work of the CHIP. And this was an agreement that came out of partnership and the work in the coalition building that happened as part of the CHIP. So that seed money really did help support those initiatives. Another potential source for financial stability is looking to both private and public sources of support, looking to ACOs, looking to Medicaid, for example, and what things can be supported by Medicaid, looking to social investors and what they might be interested in. So the degree to which the CHIP can align with existing projects and programming, align with existing priorities in terms of governmental or political priorities, will mean the likelihood of having these types of support and resources behind it. So in the case of one client, they looked at going after grants that really targeted areas of the CHIP. They aligned the CHIP with the priorities of the 1115 waiver, and they really did a very strong marketing push to look at you know, the local municipal leaders' kind of priorities, and to do some marketing and messaging around how the CHIP aligned with those and supported those. So in addition to all of these, you can have leaders who are part of the coalition to take on particular tasks and really to champion those tasks and really to support those tasks from an organizational perspective. You can also look to, as a coalition, to engage in collective grant writing to support shared initiatives, or to approach foundations or philanthropy to support shared initiatives. And some coalitions with whom we've worked have developed something, a formalized agreement among coalition partners called a strategic non-compete. And that basically says that anything that aligns with a CHIP priority comes to the coalition first, and the coalition decides how that might be addressed, whether as an individual entity or as a subset of the partners of the CHIP, before it goes out and is applied for. So that is a mechanism that can be used to support financial development on behalf of the coalition. The idea here again is to be creative and proactive, and the idea of always looking for resources and always looking at having that diversified portfolio so that there's a steady flow coming in to support the CHIP activities. And it is hard. I don't want to minimize the effort required here. It is hard, and when all of us are competing for limited resources and dollars, it's a bit of a challenge, but we have seen successful examples of this. Okay, advance.
Excellent. So I am going to talk about our second challenge, which is poor coordination and communication among partners. So many of you, I'm sure, have been part of coalitions, collective groups designed to come together for a specific purpose in the past. This is not any different than some of those other situations, and we just want to highlight some of the challenges that we've seen in the past in working with other groups in different parts of the country, because this coordination and communication element is essential to success. And it doesn't matter what part of the country you're working with or how large or small your group is, you still need coordination and communication among partners. So we have 4 elements here: convening, bringing people together, obviously the coordination of that, communication, and then your reporting. So when it comes to bringing people together, one of the big things that we talk about is making sure people are well aware up front when you're asking them to engage with you what their role will be. And that includes everything from defining their role specifically if they're going to be part of your leadership or advisory committee, if they're going to be a work group participant, letting people know what exactly is your role and what is your expectation of them in terms of time, in terms of resources, so that people are well aware of what they are signing up for and committing to. And when they are aware of that, sometimes they'll say, that is beyond the realm of what I'm interested in. Perhaps there would be another place within your group for me that would be a better fit. And that's okay too, but that gives people the opportunity to know what their level of expectation is, and everyone is clear on those roles. So when bringing people together, always be clear about how long is the process that you're engaging people for. Another pitfall that we've seen in the past is bringing people together for planning, and then there was never any conversation about implementation, about this being a multiple year plan, and people are taken back, surprised by that, to learn that later, and they didn't realize that that was the ask of them. So all important, those communication elements are important at the very beginning, so in the convening stage. Communication is also relevant in the coordination stage, so that there is ongoing communication and coordination throughout your process. So whether that's a 3-year process, a 1-year process, that there is ongoing communication, so people don't feel like things have kind of fallen off the wayside, it's not a focus any longer. They are aware of your ongoing efforts, ongoing meetings, whether people are able to consistently participate, whether it's a biweekly or monthly meeting. It's always good to still keep them in the loop, be communicating with them, be communicating outcomes, and that also touches on our 4th element of the clover here, and that's reporting. And reporting being very important, so that all of the members, all of your stakeholders that you have engaged are well aware of the ongoing process and what's happening. This not only keeps people engaged, but lets them know that there's movement. So if they are assigned to a particular content area, they realize that things are making progress in the other content areas as well, and you are bringing people together as a whole quarterly, at least quarterly, so that everyone can regroup, be on the same page, hear about successes and challenges, a very important component in this work. One thing that also helps this go much more smoothly is establishing a lead convener. A lead convener really is the lead coordinator of all of this. That doesn't mean that the responsibility of getting all the work done falls on the shoulders of the lead convener, but the lead convener is the one that is responsible for this communication, the coordination, bringing people together, following up with people about reporting. Is a very important element, and that is the job of the lead convener. Setting and maintaining consistent communication and meeting times, so that everyone's really well aware of what's happening, whether that's posted on a website, being updated in a central location so people can follow along. They know the address, they know the date, the time, they know who the person is who's in charge of that work group, so if there are questions, they have a contact person, so that all of that information is readily available to anyone who is participating. And the other thing is to keep in mind with this whole process is that this whole process is really meant to leverage your resources. And whether your resources are financial, as Rose just spoke to, or if it's space, time, money, people power, you can't leverage those resources if you aren't in constant communication with people. So the communication and coordination element is really essential to being able to leverage your resources and show demonstrable change, which is what this whole process is all about. Please advance. Thank you. So we have here a strategic opportunity, one of them being outlining a governance and organizational structure. So we just spoke about the neutral and strategic lead convener. Again, the important point here being somebody who is neutral. We want this to maintain and stay a process that is not leaning towards any one particular organization, so that people can feel like the lead convener has the best interest of the process as a whole at heart. So that's an important consideration. We did talk a little bit about the decision-making guidelines, but again here I would like to highlight that having that be very clear and the transparency element is key. So if there are decisions that are being made, that the process for how those decisions are made and the outcome of those decisions is communicated to the group as a whole. So it doesn't seem like there's one particular internal group that's making all the decisions and then it's just being reported out what those are. We want to make sure that the process is also part of that communication. And then deciding on what works for you in terms of an appropriate governance and leadership structure. So some groups decide that they would like to have a steering committee. Some groups decide they would like to have an executive committee, and work groups. Again, it depends a lot on the size of your group. Sometimes people have an advisory committee that they really are the people that kind of have the best overview of the process as a whole, but they don't actively sit on a work group for a specific priority area. So looking at the different models and possible leadership structures and decide, again, as a group, what will work best for you, and again, communicating that out to the group as a whole. Please advance the slide. So here we have annual action planning as another strategic opportunity, and this is really important. This talks about the reporting component of the Clover on the previous two slides. That reporting is really important. So here we look at, after you've developed your CHIP plan, it's really important to say you have this beautiful plan. Now what are we going to do with it? You want to action plan. So your action plan looks at your CHIP as a whole and says what of this plan in its entirety, which is designed to be typically a 3-year plan, what are we going to actually do, action plan for year 1. So you action plan for 1 year at a time, and once you've done your action plan for the first year, you want to make sure that you are reporting out every quarter on what's happened. You already have a plan for each quarter, but each quarter you need to revisit that plan and say, what were we able to accomplish? What were we not able to accomplish? Were there challenges or barriers that we ran into that we weren't expecting? And again, communicating that out so people know. This is important for so many reasons. There might be people in other work groups, in other priority areas that are coming up against similar challenges, and that helps for you all to be able to brainstorm and work together to strategize around possible solutions. This also lets all of your stakeholders, but people who are also invested in the process who might be financial contributors, know that work is ongoing, things are actively happening, they're getting a report on what's actually happening, and they can see that progress is being made. And this also, when you plan in this way, allows you to be flexible and responsive to your changing environment. We all know that the best laid plans don't always come to fruition for lots of different reasons, and that's okay too. Sometimes we're able to do more than we had anticipated, which is another possible change. But when there are changes in the environment, whether that be political or financial, partnership agencies coming and going, that we are reflecting that as a part of our quarterly reporting. And then that enables us to, when you action plan for the next year, be responsive to some of those changes and possibly change direction, add in a new partner, seek out an additional financial contributor, it allows you to be able to do that. So you'll see we have kind of like our action cycle here where we plan, then we implement, and then we evaluate. And that is meant to be an ongoing cycle so that you're in a constant state of action planning. Thank you. Please advance the slide. And another strategic opportunity for this challenge is communicating your progress. So we talked a little bit about the reporting, the quarterly reporting, and this monitoring is really essential to promoting commitment, engaging new people, because as you all know, you start with your stakeholders that are engaged in your planning process. Many of them, if not all of them, you're hoping will stay for your implementation process, but you're always going to have new people coming in. And this monitoring and reporting out is essential for recruiting new partners. So making that quarterly priority area work group reporting an essential element, making sure you're reporting that to your steering committee or your leadership body. Also making that public if you have the capacity to do so. There are many groups that we work with that have their reporting on a website so that groups are able to kind of log on and see what's happening. And then you also have a discussion about organizational benchmarks. What are we looking for? What are some of the changes we'd like to see? What are we going to do when we come up against some challenges? And also, how are we going to celebrate our successes? And celebration is another important element that we'll touch on a few times throughout this presentation, but I wanted to mention it here as well. So we have the monitoring and the tracking of our health indicators. So as part of our CHIP, that's kind of the meat of our CHIP is identifying those health indicators that we would like to see movement and change on to show positive health improvement. We want to make sure that we are tracking against those indicators. We are showing our progress, showing our successes through numbers and data so that, again, our leadership and our engaged stakeholders will see that we're making that progress, and we are communicating that. And we have some examples later to show you possibilities of how you can communicate that, but the important thing is to capture that information, track it, monitor it, and report it out. Please advance.
Okay, thank you, Amanda. We have two challenges to go. This third one is a significant one, and that is leading and nurturing leaders to be on the coalition and stay with the coalition, because we all know that this is work that is outside everybody else's day job work. So you've got leaders of organizations who sit on other coalitions, sit on boards, and lead their own organizations. So their time is limited, their attention span is limited. So how do you make sure that you have fruitful engagement from day one through day end of the process so that it is empowering and it works for the leaders that you've brought to the table? Please advance. Some of the things I want to talk about here are about formalizing and really strengthening and or marketing the benefits of being part of this partnership. And when you think about the benefits of the partnership, they are benefits for the internal stakeholders, but they're also benefits that you want to communicate externally to the community as well. And the idea behind this is to create a sense of excitement that this is the table to be at. There are lots and lots of tables around which all of these leaders sit, but this is the table where innovative thinking and passion and great minds come together to really do exemplary work and move the needle on persistent population health challenges. So you're engaging these diverse groups. You're looking for ways to engage them authentically and apply their different skills, their different knowledge bases, their different experiences to a range of opportunities in the coalition. So you're looking to identify the best places for leaders to contribute. And while you're looking to do that, you're always keeping in mind this value on their time and structuring the engagement with them around effectiveness and efficiency, so that as much as possible, the time that you're together is problem solving, thinking, solutions driven, and not sort of telling, rehashing that really doesn't advance the agenda. Formalizing responsibilities and agreements to assure that collective interests are always clear and paramount. This is kind of the idea of the strategic non-compete, but equally important is to answer the what's in it for me question. So how does being part of this coalition benefit me? How does being part of this coalition benefit my organization? So being able to, again, build excitement around the table, to market or communicate the work of the individual contributors to the CHIP and the collective progress of the CHIP is really important. Having a centralized communication hub where partners can share stories and kind of communicate with community constituencies is really important. And using the time, whether it's at quarterly meetings, it's at every meeting in the case of one client, or just on an annual basis, to reflect on what is working well and what do we need to change to make this the most beneficial experience for the partners at the table. Because having the partners there and taking care of the partners is essential for getting the work done. It's sort of kind of the oxygen mask analogy. So in return, you're hoping that you have your leaders bringing this sense of excitement and this connection to the CHIP to their other tables, speaking at other coalitions, speaking at chambers of commerce, speaking at other community meetings, speaking at community forums. And speaking of community forums and these types of meetings, they are great opportunities to recognize the work of partners. You can have a specific recognition event, you can have a specific press release, or you can, work it into other types of meetings that you're attending, you're hosting, to really recognize the partners. And it does not have to be a big thing. As Amanda said in a recent, training session we did, sometimes it's just a sheet cake that everybody enjoys and an announcement, and sometimes it's just having names and contributors on a PowerPoint or a few words said by the contributors, but always looking to give credit where credit is due and to recognize the work of the contributors. So answering what's in it for me. The last piece here is that not only do we need to demonstrate the population health impact over the longer term, we need to demonstrate the return on investment for engagement in this coalition. And as we're thinking about these annual action plans, what are metrics that are going to tell us that because we did these activities, we made interim progress that is going to move us to another level, is going to get us closer to actually moving the needle on our indicators. The return on investment conversation is incredibly important, particularly when you're talking with employers who you do want to engage as part of this effort. Advance, please.
We had a question come in. I wasn't sure if you wanted to save it, Rose, or go as we go along.
I'll take it.
Great. And so the question was regarding neutral conveners, and was asking, can you give some examples of what those neutral conveners are and explain why they're seen as neutral?
Okay, that's a great question. So a neutral convener is a respected entity, like an anchor entity in the community, who is also viewed as an entity that can be strategic and inclusive, and an entity that has been recognized for collaborative planning or collaborative partnerships in the past. The types of organizations that have taken this on include, sometimes it's a hospital, if the hospital kind of meets those criteria. Sometimes it's a health department, a local health department, or health and human services department. Sometimes it's a United Way or an entity like that. Sometimes it's a nonprofit that already is a gathering place of multiple partners. But the criteria are the most important thing to consider, that this mutual convener has to be recognized as someone who can facilitate and guide, and not someone who will impose.
Great, thank you.
Excellent. Okay, thank you for letting us know about that question. Our last challenge here is insufficient organizational development expertise. And this is something that is really essential when it comes to making sure that your project, your plan is successful. You need to have a backbone. How are we going to do this? This is everything from staff and program management, fundraising, budgeting, financial planning, internal and external communication, process and outcome evaluation, and obviously sustainability is a crucial component. And sustainability tends to be something that we talk about in almost every process, but actually making sustainability actionable takes some focus, some time, and some attention. And we're hoping that through this process will help you make that a reality for your planning process. So if you could advance, we'll talk about some of our possible solutions here. Our strategic opportunity. So this is building a scalable infrastructure. So how do we do this? You definitely need support to be able to do this. So that comes in many, many different ways. And one of the things that we like to coach people in thinking about is that support and that backbone comes in lots of different ways, and for people to be open to different types of donations. When we talk about resources, people tend to go automatically to financial resources, and those are typically at the top of everyone's list. But there are lots of different types of resources that people can provide that are helpful to this process. And here we have a few examples. Obviously, in-kind donations of people's staff time to attend meetings, work on projects, be engaged in specific initiatives. Space and technology cannot be understated here. I don't know of a group that I've ever worked with that doesn't need to look for space when it comes to having a meeting, especially if you're looking at convening a larger group. So organizations that have space that's available, that they're willing to let you have free of charge, is fantastic. Websites and technology here. We've talked about the importance of communication and getting information out, having avenues available for people to access and be able to communicate. So someone who is very good and savvy with a website or tweeting or setting up some of those social media accounts, that is a phenomenal resource that can really help when you're talking about building your infrastructure. And there are a few different ways. Some people develop this infrastructure, they communicate it out, they're very happy with that, it works for everyone in the group. There are other organizations that choose to make it a more formalized process, and they want a single organizational partner. They might choose to incorporate themselves as an independent 501c3, and there are lots of pros and cons to that. We've had some groups that have had the intense discussion of, we would like to go for foundation funding. In order to be able to go for foundation funding, we need to incorporate ourselves as a 501c3 nonprofit organization, which is a very good solution and a good possibility. You're always going to be, the issue of funding won't go away. So if that's something that your group feels strongly about, then it's a wonderful option. You just need to know that there's some work in getting that going, initiating that paperwork, and maintaining your status as a nonprofit organization. There's obviously ongoing work, so you would need to make sure that you had that backbone infrastructure in place to support you in going through that effort. Anything here that you would like to add, Rose, or should we open it up to questions?
I just have a couple comments to add here, and thank you for asking that. Some of the things that the backbone would do, these are just kind of task-oriented things, but it's important to consider. Contract management, that function, serving as the primary point of contact for the coalition, gathering any information or materials produced by coalition partners or by working groups, and having that be distributed or available to other partners. So the whole idea of document management and managing kind of the templates that people use for planning and reporting is really important. And what we have found in a number of cases is that organizations will either pool resources or develop resources to hire a staff person, at least part-time, who can do some of these activities. And whether it's hiring a staff person or buying a piece of that staff person's time, having someone who can do these things when you know it is a central part of their work really does help facilitate the process.
Great. So it looks like we have a question in, and the question is, what are the pros and cons of having the neutral convener organization be the same as the backbone organization?
I'll take that, Amanda.
Sure.
So the pros are that it's fairly seamless, and the neutral convener can kind of have all of those resources at their disposal to kind of organize people, send out emails, post things to a website, et cetera, et cetera. The con is that all eyes then turn to that neutral convener and backbone and say, well, this is your plan. And then it becomes, you know, a lot of burden on the backbone and the neutral convener to constantly say, I'm a partner and a convener, but I don't own this plan. I own pieces of the plan that I've signed up to do, and I've signed up to be the convener piece, but this plan is not my plan. Does that make sense? Amanda, do you want to add to that?
I agree. I agree with everything that you said. I think that there are definite pros, and I think that one of the largest, as you've already indicated, is that communication component, which is really essential. We can't emphasize that enough to making this be successful, and that ongoing communication and having somebody who really has their hand on the pulse of keeping it all together, if you will. So as long as they can maintain their neutrality and make sure that the interest of the process as a whole is at the forefront, it's not a bad idea.
Yeah, what we find is that in cases like that, where we've provided technical assistance, we remind that convener backbone entity to affirm the community nature of a CHIP, that it's not an organizational plan, it's a community plan, and to constantly define their space in the conversation and their space in the plan.
I think that makes a lot of sense.
Are there other questions on any of what we've presented or on things we haven't presented? Because we're happy to entertain all questions, and if we don't have the answer, we'll tell you that too. If you ask us what the weather will be like tomorrow, we will give you a guess, but we really don't know.
Yeah.
I think a question for me that came up as you both were talking in terms of communication, and I know the issue of burnout comes out because the chip process, I think, can last for a really long time, both planning the chip and implementation of the chip. Is there a best practice or some sort of sweet spot in terms of how often coalitions or groups are getting together? Like, should the planning be twice a month, once a month, and then implementing more than that or less than that? Do you guys have any advice for groups that are trying to figure out how often to be meeting with their groups?
Amanda, do you want to take that and then I'll follow on?
Yeah, can you just repeat that again, please, Gina?
Sure. I just
Kelly?
was asking if there's a best practice or a guide to go by in terms of how often you should be meeting to plan the chip. Is it you're meeting more often during the planning process and less during the implementation, or if you guys had any advice?
No, that's a good question. So I think this obviously depends on when you're engaging your stakeholders and you're asking them for that level of commitment. You definitely want to make sure that this is a conversation that you engage them in so that you get their buy-in. And there are some groups that say we want to meet biweekly. That doesn't work for everyone. In reality, you are meeting more frequently during the planning and less frequently during the implementation action planning phase. For the action planning, I would say minimally quarterly. It would be better if you would meet on a monthly basis. Planning is typically more often than that. So, you know, there's definitely a balance, but I would say the definite minimum for implementation would be quarterly because you want to make sure you're reporting out quarterly, and you can't report out if you're not meeting. So in the implementation phase, when you're really kind of digging into the meat of the action plan and trying to get things going, monthly would be my minimum recommendation. I don't know if you agree with that, Rose.
I do. And so, I'm going to say a couple of things. One is a recognition that fatigue does set in, okay, and that we've talked about this in other forums, that you know, the assessment to planning to implementation to evaluation process is a 4-stage process. And it helps to kind of recognize that going in so that you know that you're in it for a longer haul. So you're not done once you complete a very beautiful and rigorous assessment, and you're not done once you complete a very beautiful plan. The idea of the plan is that it is a dynamic document, and for it to be dynamic, it needs to be a mechanism around which people engage regularly. And so once the annual action plan is developed, I agree with Amanda, whatever subsets or groups are working on particular areas of the chip need to define for themselves how often they need to meet to really move forward on particular strategies that they are implementing. And it may be a monthly meeting and a pre and post conference call for the implementation. For the reporting and kind of, you know, cross chip collaborative kind of understanding piece, quarterly is our recommendation, and it is a best practice from a monitoring standpoint. A lot can change in 3 months. We've seen it happen. So being able to come together every 3 months and say, you know, here's what's going well and is on track. Here's what's stalled, but we think it's still kind of on track. And here's where we're dead in the water, and we really need the advice of other coalition members for how to get unstuck, or whether we should just, you know, abandon ship on this particular strategy, is really, really important. So in terms of the planning piece, it's one of the reasons why we recommend sort of the rapid planning cycle, because you can get the sort of framework and guts of the chip completed in a day, and really spend the bulk of your time refining the chip, doing the action planning, and actually doing the work, which is where the effort really needs to be.
Great. Thank you both for that answer. I think it really brings home the fact that everyone needs to hold a piece to it. And I think speaking to that, we had another question come in that if either of you had any strategies for convening a local health department to give up some of that control, quote unquote, of the CHIP coalition.
What a great question. Amanda, do you want to tackle that first, or?
The question is suggestions for a local health department to
give up control of the CHIP a little bit. Any strategies for addressing that?
Give up control.
Yes.
Is that so? I think the biggest kind of like our the speech we take on the road, if you will, is that when you're doing this type of planning process, the first word in this process is community. And this process will not ultimately be successful in the way that you want it to be if one entity is holding control. It kind of goes against this whole stakeholder involvement, bringing everyone together. Everyone has a little piece. This is all about collaboration and the combining of resources and assets to make positive population health change. That won't happen if it's one entity controlling everything, because people will feel like, well, they've got it covered. Why do I need to show up to the meeting? Why do I need to be engaged in the process? Why do I need to be part of this action step? Why would I do that when they've got it covered? Ultimately, in our experience, and Rose, I'm sure you have something that you can relate to this from all of the plans that we've done, but ultimately, it's not as successful in that you haven't been able to engage that multi-stakeholder community investment in your plan if you are not, the whole point of bringing in and engaging stakeholders is to keep them engaged from the planning to the implementation process and then onward. And that won't happen if one entity is maintaining the control and is the person, the organization that's saying, who does what when, what is more dictating what's going to happen. And that may or may not be the case, but I think that, when you engage in this process, if you can have that conversation right up front, and I was just at a meeting this morning and beginning of the process, and this is the conversation we had right up front. If you really want this to be a collaborative process, if you really want this to be people coming to the table with a purpose to sustain what you're doing here, to change, make some demonstrable change in systems, in how you do things, cross-collaboratively, then that's the approach that you start out with.
I think all of those points are really excellent. So, the first point is you're not going to get what you want if you behave, what's important to you and what your priorities are, you're not going to achieve those things if you kind of execute in this way. I will say that I can think of a particular instance, and it wasn't with a local health department. It was with the convening entity, and I will leave it at that, who was problematic. Problematic in the community and also problematic for the coalition in terms of being very directive and very controlling and messaging out to the community in ways that coalition members couldn't fully support or seem counter to kind of the philosophy and intent of the CHIP. And ultimately, there was a facilitated intervention, among kind of the executive committee members with this lead entity to kind of say, this isn't really working, blah, blah, blah. That then downstream kind of led to a larger coalition decision to become a 501c3, its own entity, so that it could achieve more sort of collaborative control, if you will, over the process. But that was a very painful process and a painful decision. I would not advocate necessarily having to go down that path, but having the conversation up front certainly can help kind of avoid some of those pitfalls. And then also being just very clear, we talk about, coalition charters, and saying, here's the charter for the coalition and here's your role in the coalition. We actually formalize that and have participants sign those agreements, so that you have something that you can go back to say, this is what we're asking you to do, and these are kind of the guiding principles around being a lead convener.
Great, thank you both. And I want to encourage participants that are listening in, please send in your questions, comments, wherever you are in the CHIP process. Rose and Amanda are more than willing to answer any and all questions. And so we're happily waiting for those questions and comments to come in as well.
I guess I have a question for the audience, if I might. If you think about the biggest challenge that you're facing right now, what is it? And if we haven't addressed it, could you give us an idea of what that is, so maybe we can think about a way that we would address it?
Great. Think about your biggest challenge. Right on the right hand of your screen, you'll see the panel, and type into the question box what you think your biggest challenge is going into the CHIP, or maybe sort of what you envision your biggest challenge going through the CHIP is if you haven't started that process yet. So we'll give people about a minute or two to type that in. So type it right into the question box and it'll come directly to us, and then we can give that information to Rose and Amanda to feed off of. I promise we won't bite. You won't get in trouble. All right, so it looks like we have a couple of comments and questions coming in, and it says, can you just do a quick reading of each strategic opportunity headline as a quick refresher? So it looks like we need some quick refreshers.
Okay. If we can go back on the slides, that would be great. And I'll read through these, Amanda, if that's okay.
No, that sounds good.
Okay. So our first strategic opportunity is to develop and secure diverse resources throughout the process. Our second strategic opportunity is to outline and formalize a governance and organizational structure that includes the role of the lead convener and specifies decision-making pathways and processes. Go back to 2C.
Oops, sorry.
2B, yep. Our next strategic opportunity is to use annual action planning as a way of coming together to facilitate quarterly reporting and to make sure that the CHIP is a living document and is flexible and responsive to changing environmental factors. Our next strategic opportunity is to continuously communicate progress and to communicate the benefits of being part of the coalition, both internally and externally, to stakeholders, thinking about how do we market our successes, how do we share our stories, and how do we demonstrate our return on investment. The next is really continuously nurturing, formalizing, and strengthening the benefits of the partnership, and really being mindful of what is needed for leaders to stay engaged with the coalition. So recognition events, sharing or providing vehicles for organizations to share their stories and talk about what they're doing at an organizational level that supports the CHIP, and encouraging leaders to think about the CHIP front and central as they're sitting at other tables, so that they're speaking at other coalitions, at chambers, at other community meetings. So always looking for ways to engage leaders and say, this is the table. This is what's in it for you. This is what's in it for your organization and our community. The next is really building the infrastructure that will support this collective effort. Everything from having the communications mechanism, the contracting mechanism, the administrative piece, to setting out meeting reminders, etc. Having a technology portal, all of those things, having a part-time staff person to support these efforts and really provide that integration, convening, organizing piece for the CHIP and the coalition.
Great, and it looks like we had two submissions of challenges.
Yep.
The first one is, looks like the organization has an active CHIP, but the primary challenge is that intermittently the primary agency does sort of take over, which dissuades participation. And have you found guidelines or protocols that help prevent that? And I know you spoke to that a little bit, but it looks like they're looking for a little bit more guidance.
Okay. Amanda, do you want to speak to that, and then I'll add to that? I'll just jump in on that. So this is really tricky because, and which is why you're raising it as a challenge, because it's tricky. You have organizations that have different power bases. If they're coming to the table with significant resources, that's obviously attractive, but can also be a source of power that can be kind of difficult to negotiate. Having the coalition as a coalition develop operating principles for the coalition is one way that we've kind of gotten around this. And these should be formalized so that you say, in our engagement with each other, which includes how we do our work, how we make our decisions, how we communicate, etc., what should be those kind of essential principles, and how do we live those principles in our engagement, internally and externally. And then that becomes, you know, the yardstick that you can measure group performance against and kind of say, you know what, you know, we're having a bit of an issue here. And you can do that in sort of a neutral way without calling out necessarily a particular player. And it's something that you have developed together, so it's something that presumably you all want to uphold. The other thing that you can do is at the end of every meeting or a conference call where you're kind of coming together is to reserve 5 to 10 minutes at the end of the meeting to do a plus delta at the end of the meeting. It's a very quick meeting evaluation. It's part of kind of being a continuous learning organization where you say, plus what really worked here in terms of, you know, getting materials in advance, having clear objectives, facilitating the process, blah, 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 and what do we need to change to do this even better next time. And in the changing to be sort of neutral and talking about behavior rather than judging that behavior. So to say, we had participants, we didn't have full participation in the conversation, and we need to be mindful of that since it is one of our guiding principles to make sure that we engage all perspectives around the table and open up space for that. So that's kind of a strategy that we can use.
Great, thank you. And then
that's excellent. Sorry.
Go ahead.
I was just going to add to that I've had two experiences with this. One is that this issue came up at you're in a situation where you have an active chip now. I had a situation where this came up at the beginning of the development of the chip where people were vocally concerned about the primary agency and what their role would be. So in that situation, we were able to, from the onset, set out these goals and these mechanisms from the beginning of how the operating principles. So that's always a good conversation if you have the opportunity at the beginning, regardless of whether it comes up right away as an area of concern, because ultimately when you're doing something for 3+ years, it may likely end up being a concern. Another thing is, and I've used the Plus Delta before, it's a great tool. Another tool that I've used with groups is a quick Survey Monkey. Sometimes you have people in a group for whatever reason, whether it's political in nature or financial funding in nature, they don't want to speak up, but there's grumbling in the background, and the grumbling in the background can serve to stall your progress. So another avenue would be to do a quick Survey Monkey, very similar to the Plus Delta, what's working well, what's not, so that people feel like they can have that voice even if they don't want to speak out verbally in a meeting. So that's just another tool that we've used.
That's a great one. And I think, like with all of these, if there is another respected, partner at the table for, the entity that is being more directive, sometimes having that, face-to-face, one-on-one conversation to say, maybe we need to think about different ways of processing this, that can help too.
Great, thank you both. Those are some really amazing strategies, and it looks like we have somebody else that's had a question. Having done the assessment part, there was a lag moving into the implementation, and then the question is, should it be the same people or a new cohort who focuses on the implementation, and tips for motivating people to participate?
That's a really great question. Amanda, do you want to start, or do you want me to dive in?
Sure. I think that there's multiple answers to this question.
Yes.
I think ideally, if you have people, and typically there are people who are really invested in this process as a whole. They've got the motivation. There's always a stream of continuity between your planning and your implementation. That being said, depending on how your process is going, where you are in the process, how long it's taken, you will have people that drop off, and you will have people that you're always in that constant engagement of recruitment, always, because there's new staff turnover, there's new programs, there's new opportunities for collaboration that come on board. So you always want to be open to engaging more people and kind of having a recruitment line, if you will, for engaging new people. But I think that the element of continuity is important. So you want to try to support people that have that got engaged from the beginning, that are passionate about the process and the project as a whole, because their level of enthusiasm will be contagious to others. So it's a little bit of both.
I'm going to add to that to say continuity is important, but another way to think about this is you can have the same organizations participating, but maybe different levels within the organization participating at different phases. So you could have the leaders of the organization participating on an advisory committee and maybe during, the planning piece. And then once you get to kind of the work group, annual action planning implementation piece, you have a next level down or a designee or a couple of designees who work on behalf of that organization. So you still have continuity and you've got some fresh blood coming in. The caveat there is that anything that is a developmental process where there needs to be kind of agreement and sign-off requires having the decision maker at the table. And so that's important to keep in mind. Once those decisions have been made and kind of those agreements have kind of been made, then you can look at being flexible in outreaching and recruiting other members to the table. The piece that I do want to emphasize is that you celebrate the participation, that you kind of launch one phase of the process, and then you celebrate and sunset that phase before you launch the next phase, so that it's very clear that, okay, that was the planning phase, now we're doing the implementation phase. And the implementation phase is about doing. It's about rolling up our sleeves and actually digging into the work and doing, so that even if you're having different members, that feels okay because it's a different kind of task that is before you. And hopefully that makes sense.
Great, thank you both. We do have still a couple of more minutes in the webinar if anybody wants to chime in with more questions and comments. If not, we can definitely wrap up a little bit early. We'll want to thank those that have submitted questions, but we'll give it a few minutes for people to chime in and write your questions. I realize it can take a while to type in those questions in that little box, especially when you're within the CHIP process, because the questions tend to be multi-layered. So we'll give you a minute to type in there, and then Rose and Amanda, I don't know if you have any more comments moving along, but we'll just give people a minute to start typing in if they have any more burning questions or comments. All right, so it looks like we can go ahead and move along. We want to thank you for participating in the webinar and asking all of your questions and everything that Rose and Amanda said. Thank you so much for the presentation. We appreciate your willingness to answer all questions and comments. We want to let everyone know that as soon as you close out this webinar, a survey will pop up. We want to encourage you to fill out that survey. That helps inform us for future webinars and trainings. And as we're coming up to our next year, we'd love to hear your feedback. The slides and helpful information will go on, be sent to you, in an email after this webinar, and we want to make sure that we get your feedback form. So if we get your feedback form and you fill out that survey, we'll go ahead and send you those resources. And again, if you have any other questions for Rose and Amanda that you weren't able to ask today, please send them to our Community Health Training Institute website, and we will send them along to Rose and Amanda, and they'd be happy to answer them. Again, thank you, Rose, and thank you, Amanda, and we hope that you have a good rest of your day.
Thanks, everyone.
Thank you so much, everyone.